Well, welcome. Good afternoon to a bunch of you. Good morning to some of you, depending where you are looking at the chat. Y'all are all over the place, which is cool. And I'm a little bit jealous. Somebody's in St. George. I'm kind of jealous about that. So thank you. Thank you for joining and hanging out for a little bit. So yeah, NAEMSE asked me to talk a little bit about curriculum and development and what it is. So that's what we're going to do for about the next hour or so. And so let's talk a little history first. So curriculum, like most of the stuff, has a Latin derivative, which means to run or to run the course. And the first actual literature documentation about it was written by John Franklin Bobbitt. And he actually wrote a paper called The Curriculum. It's actually, if you're interested, it's downloadable in PDF form. You just read it, but it kind of talks about the curriculum and the structure of what it is and how to put it together. It's a little bit of a nebulous topic. Sometimes when you talk to people, when they want to know what it is, and I get a bunch of questions about which curriculum do I use, and then we reference marketable materials. And so let me start by just talking about what curriculum is not. And curriculum is not the textbook. So the textbook may play a role in your curriculum, but that's not the curriculum. The curriculum is not your PowerPoint. EMS education standards are not the curriculum. I think most of us know that the ed standards are in the process of being redone. And it's interesting with the first go round of the education standards. I think long-term educators were familiar with the old DOT curriculum. And so you got this DOT curriculum and you open it up and it basically said day one, you'll do this, day two, you do this, day three, you do this. And then ed standards came out. And the ed standards came out, and when they came out around 2000, 2001, they were this just overarching kind of thing, which we'll talk about here in just a minute. And EMS, a bunch of educators were kind of lost, right? What do we do? And so we created the instructor guidelines. And I think there was this sigh of relief of people saying, oh, there it is, there's the curriculum, we can now go forward and teach. But with education guidelines were just, the instructor guidelines were just a template, an example of what we could do and how we could teach. And now the ed standards are in the process of being revised, I think, which is good. And a lot of the information and feedback that's been given to the revision committee is that of, well, you need to add this to the curriculum and add this to the curriculum. And ed standards are not the curriculum. And we'll talk about more of that just a little bit. National Scope of Practice is not. COA is not the curriculum. And nor is National Registry of EMTs. And I hear students say that a lot. They'll say, well, is this following the National Registry of EMTs curriculum? And it's not, there's not a curriculum. So this is what it's not. So what is it? Well, all these people, John Franklin Bobbitt, as I said, was kind of the first author, but even John Dewey back in the early 1900s started talking about what is curriculum and curriculum design, and he was big on educational reform. But all of these people are published and well versed and then considered experts across time in curriculum and what curriculum is, and they all have different definitions of curriculum and how it is and how it works and how it flows. But it all basically, they share some components, and the components basically are, what are you going to teach and how are you going to do it and how are you going to revise it and where are you going to put it together. So for purpose of today, I came up with this definition of curriculum. And curriculum is the determination of depth and breadth of content to be learned, the processes in place to create the experiences to facilitate the learning, and the evaluation of outcomes resulting in a reevaluation of content and processes. And that's very long and wordy and verbose, but that's basically what we're talking about. The development of curriculum is answering all these different pieces and these little parts about what we want to teach and how we're gonna do it. And we have all those tools. So ed standards give us some guidelines, and registry is going to test if we've met those guidelines, and the education or the scope of practice document is going to temper what we teach a little bit and how we teach it. And then COA is going to oversee us and make sure we're doing it and meeting all the goals that we've set. But when it comes down to curriculum, curriculum is you. So there's tools you can buy. American Heart Association is a great example. American Heart Association, when you purchase the instructor package for ACLS or CPR, BLS, or for PALS, you've basically purchased their curriculum. And when you open the book, it starts day one. This is how you register students for the course, and this is how you set up the ratios, and you start by pushing play on this video, and then you answer these questions, and here's the scripted words of how you answer these questions. So that's an example of a curriculum you would actually purchase. And it's evaluated by a test at the end, created by the American Heart Association. And there are tools like that for education programs in EMS, but I think we, as educators within our programs, need to kind of take some ownership in this and realize that the curriculum that we're going to make is what we choose to make it, what we're going to do. So let's take a look at this. Daniel and Laurel Tanner, they said this in 1985, in the absence of a holistic conception of curriculum, the focus is on a piecemeal and mechanical functions. And I think EMS falls victim to this a lot. I think instead of looking at our program, and it's kind of interesting, and there's some questions about what we consider is a program. In the state of Colorado, for example, paramedic education is actually 15 individual courses. And so you have medical emergencies, and you have cardiology, and you have trauma, special considerations. But so each one of those may have a curriculum piece, but then you have the paramedic program, which is the entire program, which needs to have a curriculum. And then the paramedic program then fits into the college, which is associated with associate's degree and baccalaureate degrees in paramedicine. And so all of this stuff has to come together to meet the curriculum. And I think what happens in EMS a lot is we kind of piecemeal it. And so today is a skill day. And so when we have a skill day today, we're going to focus on backboarding and if anybody still has those, I guess, traction splinting and wound control. And then tomorrow we'll focus on airway management. We'll talk about ventilation by a bag mask device, placement of oral pharyngeal airways. And so we tend to piece it together. What we really have to make sure is that all of these pieces come together into this one overarching kind of curriculum that we have to put together. I know a lot of times in programs, there's the questions about how content should be delivered. So should we chunk it? Should we do airway and then cardiology and then med emergencies and then pharmacology, or should it all be kind of put together? And I'm not sure there's a right answer. I just need to make sure that I think we should be intentive about what we do to make sure that there is a process, and so we don't end up like Daniel and Laurel have suggested, that it becomes this piecemeal mechanical thing, because then at the end it doesn't come together. Things tend to fall apart. Tyler talks about 4 fundamental questions when putting together curriculum instruction, and I think these are foundational. And Tyler, I think, gives us a good representation of what it is that we need to focus on and talk about. And so question number 1 is, what educational purposes should the school seek to attain? So what do we want to do? And we're going to break this down here in a little bit. But what's our goal? The other thing I think we need to be careful about defining is, how do you define school? What is your school? So is your school the EMT school? Is the EMT program the school, or is the EMT program a component of a bigger thing? And maybe the bigger thing is the EMT program is a component of the fire academy. And so as a component of the fire academy, are you talking about the school being just the EMT school, or are you talking about the entire fire academy? Here at the college, the EMT program is a component of the academy. And so we want to make sure that the EMT students are ready for the preparatory work, ready to go to field, ready then to matriculate into the paramedic program. So you kind of have to define school, or what's your goal of the school. Second question is, what educational learning experiences can be provided that are likely to attain these purposes? This needs to be purposeful on our part. What are you going to do to help these people learn? And I'm a big advocate, proponent, and I've said it before, that the ability to teach people things, I think we're a little bit limited in that. I think all we can do is facilitate their learning. And so we want to make sure that there are experiences in place that can facilitate this learning. And that may be limited. And again, we'll chat about that in just a little bit more. And then number three, how can these educational experiences be effectively organized? Sequence matters. Sequence matters. Things have to come in order. So obviously, we can't have a drug calculation lab until we've had some information about medications and calculations and how you put them together. So there's some sequence that needs to take place. We probably need to be able to do a physical exam or a trauma assessment before we start running trauma scenarios. So how do we put these things together effectively to make sure that each component is then synergistic? Going back to the Tanners, we don't want it to be this individual piecemeal kind of piece. And then question number four, how do we determine whether these purposes are actually being attained or met? And this is where we take a look back to see if it's actually working, to see if what we thought we were doing is actually what we were doing. And sometimes, I think many times in life, what we think we were doing is not actually what we were doing. You have to fix it. You have to fix it. All right. So Eisner in '94 said that there are three essential versions of curriculum, which I find fascinating. One is the explicit curriculum. This is what I want to teach students. So this is what I want them to know, and this is how I'm going to do it, and this is what I'm going to teach them to do, and this is how I'm going to evaluate it, and this is what we're going to do. Then we have the implicit curriculum, and the implicit curriculum is what is learned, but it's not intentional. So it's stuff that is evaluated or taken away by the students, which is not an intentional piece. As an example, here at the school, in our paramedic program, I do a fair amount of the teaching in the paramedic program. And then we have some other instructors that teach other components of the course. In some of the components of the course, students were struggling with that. And it was components that I maybe wasn't necessarily involved in. So in evaluation with the students and talking with the students, the feedback became interesting. They basically said that based on who was teaching the course or teaching the classes, they inferred that it was important or not. That's an implicit curriculum. So it's something that they're taking away that was not intended. So they were interpreting things that were not intended to be interpreted. And then the third one is null curriculum. What do you choose not to teach? And this becomes pretty interesting, and it's kind of an unknown continuum of, it can go on forever, but we can't teach everything in an EMS class. But what you choose not to teach, the students are going to make some determination about how to manage those situations, whether they're aware that they didn't know it or they weren't aware that they didn't know it. And what do they say? Being unconsciously unconscious, not knowing what you don't know, is kind of one of the scariest places to be. And the good learner is someone who all of a sudden becomes consciously conscious and consciously unconscious, and they are aware of what they don't know. And as soon as they are aware of what they don't know, then they can go seek that information. But null curriculum is what you choose not to teach, either intentionally or unintentionally. And all of these are going to affect student outcome as we move forward. So curriculum development. First thing you have to ask yourself is, what's your goal? What do you want students to do? So do you want them to be technically proficient? So do you want them to be able to do the skill? In the state of Colorado, we have this ability for EMTs to start IVs on people and give fluid. And we've added a bunch of medications that EMTs can administer independently. And there's a state suggested curriculum to go along with this. And recently that was modified, and there was some pretty interesting discussion at the state level. There was a bunch of people that wanted to increase depth and breadth of knowledge, and then there was another facet that basically said, nah, just teach them to stick needles and teach them how to turn it on and turn it off, and that's all they need to do. So what do you want them to do? Do you want them to be technically proficient, and that's your goal? Or the other possibility is maybe we want well-rounded lifelong learners, which is great. People can go forward and it sounds really grand, but maybe they're not technically proficient at all. They just spend their life learning things. So you want to focus on this well-rounded lifelong learner piece, or you just want them to pass exams. you just want them to jump the hoop. And maybe the certifying exams are something in your school. Maybe your state has a certification exam. I think most people are probably using the registry at this point, and maybe it's the registry exams. You want them just to pass the certifying exams. And passing the certifying exams is a necessary evil, but I think when we look at registry, and big fan of registry, but registry is written at the lowest common denominator. So registry talks about minimum competence. And so if we just want them to pass the certifying exam, we're basically saying we want students to be minimally competent. And that's fine. That's fine. But you need to identify what you want your students to do. So what is your goal as you're putting this stuff forward? Next question is, what do you want to teach? So this is an excerpt from the EMS Education Standards. You can find it there, ems.gov. But when you look at this, and I think probably most people on the attendees list has probably seen this before, but this is how it breaks down topics. And I just extracted endocrine disorders. And so at the EMR level, we just need to tell them that they're diabetics. That's about it. In EMT, we want EMR plus a foundational depth and foundational breadth. And then AEMT, we got complex depth, foundational breadth. And then at the paramedic, we have all that previous stuff plus anatomy, physiology, epidemiology, pathophysiology, psychology, and we need this complex depth, comprehensive breadth. And then there's some examples of diabetic or endocrine stuff that we should talk about. So when it comes to curriculum development, you have to look at the group that you're teaching, and to some degree, you have to define what you think what this is. So if you're teaching EMT classes, what is fundamental depth and foundational breadth? How do you define them? Here's where the textbooks can come into some assistance. So the textbooks, and a lot of it's going to depend on the author. So we have the AAOS textbooks, we got the Limmer books, the Miskovich, Joe's book. We have all these textbooks that are out there that can help us. And you're getting the author's interpretation of what the depth and breadth this student should know is. And so that becomes a guide for us. And I think that's why people choose textbooks. I've heard people evaluate textbooks at all levels, and they'll say, well, I like this textbook, but this textbook goes into too much depth. Okay, fair. It's as long as that author is kind of coinciding with what you want to teach, but you have to come up with the evaluation of how much stuff and what's the depth and breadth that you might be able to, that you want to teach. And then hopefully that coincides with the registry piece. So when you look at this, we got the breadth. So the breadth is how much stuff do they need to know. So awareness is basically that they know that it exists, right? So the EMR needs to be aware that there are diabetic emergencies. Got it. And then we got foundational, and we have comprehensive. And then comprehensive, which is typically the paramedic level stuff, what is comprehensive? And there's some different definitions to that, but comprehensive basically spans a huge wide gap of stuff. Depth then is how much stuff do they need to know about this stuff? So again, the awareness level, diabetics, they exist and they can go unconscious. Got it. That may be a very awareness level breadth and depth of information. But you get all the way down and you get this complex depth. So paramedic level, for example, they commonly suggest that we want a comprehensive breadth and a complex depth of knowledge about topics. And there's a lot of debate about what that looks like. So do we need to, just talk about how medications work as far as signs and symptoms? Do we need to talk about the cellular functions of these medications? EMTs commonly they learn that albuterol is a beta-2 agonist. Great. What does that mean? They probably don't know. Some EMTs just know that albuterol just bronchodilates. That may be a foundational breadth of knowledge that they need to know. Again, these questions need to be asked by you, and they're answered by you, and they're individual for your program. So talk with the other faculty and talk with your medical director to find out what is the expected depth and breadth of what we want these people to know. Then you have to figure out how are you going to teach it, or how are you going to facilitate their learning. Dewey said that learning is nothing but a chain of experiences, and people interpret those experiences. And as educators, we should help them interpret those experiences. So We could lecture, and lectures pretty easy to do. Put people in a room and just tell them things, kind of like I'm doing now. Just talking to a whole bunch of people and just telling people stuff. You can facilitate discussion. That becomes a little bit difficult to wrangle in the groups, but discussions and Socratic method tend to help critical thinking. Maybe you're just doing some student-focused reading and independent study. Maybe you can do some video case studies for students to evaluate and go back and discuss. Scenarios and simulations. I think that as educators, we probably know that if we get a big bang for our buck with well-crafted scenarios and simulations, if they're put together appropriately with learning goals and then are debriefed appropriately at the end, I think we get a huge bang for our buck with scenarios and simulations. But they're labor intensive and they're time intensive and they're space intensive and they're equipment intensive. And so we have to look and say, what do we need to teach? Depth and breadth. What do we want to teach? Depth and breadth. And then how are we able to do it? And we have to kind of put that together. The other option is you're just not going to teach it. It's not something that you're gonna talk about in your class, either because you don't think students need to know it, or you're guessing that registry is not going to ask a question on it. Maybe this is something that you're not going to teach, which is fine. We can't teach absolutely everything, and a lot of that comes up to you to choose what you're gonna do. And then we talk about sequence, and sequence matters. Sequence matters. But I think COE at one point actually had a webinar online about sequence and the importance of sequence and sequentially providing information. But we have to ask and say, kind of go, what prerequisite knowledge is necessary? So before I talk about this, what prerequisite information is necessary? So they have to do that. So I have to teach the prereq stuff first. If you're doing clinical rotations, where does it fit in? As an example, I need to make sure the big crux for our program is I need to make sure that the students have the obstetrics content before I send the paramedic students to their OB clinical. So we have to make sure that they have the information before they do stuff. Equipment, sometimes equipment is not available. So if you're sharing equipment, either with the nursing department or other EMS programs, how do you sequence it so you have the equipment available, especially if you're using simulations and scenarios? And then when do the students need to know it? So when do they absolutely need to know this information? And so putting it together, you kind of have to piecemeal it and put it together first and second and third and fourth. One of the big things with the EMT program, the discussions I've heard over the years is, do you teach trauma first, or do you teach medical first? And which component should come first? So assessment, we got that should come first, but then do you focus on medical topics, or do you talk about trauma topics first? And I'm not sure there's a best answer, but that's kind of what I'm talking about, is what's the sequence? When do you teach it, and how do you make it work? And then you got to go back and evaluate it. So how do you know if all this stuff actually worked? So we have classroom exams, and class exams are important, but this would be a whole nother webinar that, and there's a bunch of information out there, but how do you make sure that your exams are working? Exams are something else you can purchase, and there's a lot of vendors that sell exam and examination products. But as educators, you kind of have the obligation to make sure that the exams you're giving the students are actually doing what you want your exams to do. And then be careful about your exam. So after the students take an exam, you should go back and you should evaluate that exam and make sure that that exam is valid and reliable, using whatever tools that you want. I would caution you from just buying a tool and just putting the tool out there. So some tools are good. I'm not saying that there's not good tools out there, but you as the educator have the responsibility to make sure that the exam that you're giving your students is appropriate for what you want that tool to do. COE will come in at this point for the paramedic level, and they'll ask about your exams, especially your comprehensive summary exams, and ask how you evaluate them, and ask how you know they work, and ask to see your data. So yeah, make sure your class exams are good and they're actually doing what you want them to do. Sometimes it's hard if you're teaching an advanced depth and breadth of content. Writing test questions that actually evaluate that advanced depth and breadth of content is tricky. It's hard, but we need to make sure that we're doing that. Check your NAEMSE results or your state exam results. Are your students passing? If your students are passing your class and they're failing the certifying exams, there's a gap. Something's missing somewhere. So the certifying exam either thinks that they need to know a depth and breadth that you're not teaching, or if you're teaching it, maybe they're not learning it. So there should be a gap there. So pay attention to that, and then get feedback. So employer feedbacks, advisory committee feedbacks. Ask how your graduates are doing. Are they doing the job? Are they able to do the assessments that they want? So get feedback from those groups of interest. Check with COE. Are you in compliance with their standards? Everything that they need to do, and then ask the students. So did the students feel prepared? So did the students feel like they were ready to go and do what they needed to do? So get feedback from all the way around. And then this is the hard part. What do I need to change? So what was not taught that should have been taught? So did I teach something or mention it, but I didn't actually teach it to the depth that I should? Or did I skip over it altogether? I decided I shouldn't teach that piece of information. What should have been taught more in depth? And teaching is interesting. That third bullet point, what did I think I taught but the students missed? I covered that. The definition of cover, and I've heard a lot of instructors say that we covered that in class. Don't you remember we covered that? To cover means to hide, to conceal, to keep secret. And I don't think we want to do that in education. So what did you think you taught but your students missed? And you should pick that up on your evaluations. So your tests, by evaluations I mean tests. Hopefully the tests are going to be able to pick up what you missed, and find the gaps or the holes in the process that we need to go back and fix. And test evaluation becomes interesting because we shouldn't just take a student score and go, hey, you did 79.9, we'll round that to an 80, you passed. We should really go back and identify what was missed. What are the content holes? Because we shouldn't be okay as educators being okay with the 20% of knowledge that they didn't get. What the students learned that I didn't want them to learn. I mean, did they pick up on some bad habit? And the bigger a program gets and the more people are involved, so we get our primary instructors, but then we have our adjunct instructors or our skill instructors that come in, and they're great with war stories and all kinds of stuff, or shortcuts, or then the old, then there's the classroom way and there's the real world way. And we hopefully those two things should be the same. The classroom and the real world should have some type of synergism, and they should be the same type of thing. So what did they learn that I didn't want them to learn, or that was mislearned, or I didn't want them to know, or something wrong? And then where'd that come from? And then what standards weren't met? We know that we have the document paramedic level, the document formerly known as the Appendix G, where we have all these skills and assessments and patients and everything else we need to come in contact with. And so what didn't we meet? And then, and this is a tough question, is what do you need to do differently? So sometimes we need to modify stuff. Maybe we need to add stuff. But the other thing, I think it's the harder thing, I'm just speculating, is what do we need to remove? So what do we need to take out of the curriculum? What are we spending time on that we don't need to spend time on? What are we doing in our educational arenas, be that the classroom, be that in Zoom WebEx, be that in a scenario session, be that clinical rotation? What are we doing that's not working? What are we doing that's maybe even injurious to the students? What do we need to take out? And so as we cycle this process around, and you need to ask these questions, what do you need to change? What do you need to remove? What do you need to do differently with this thing? Wiles and Bondi said that we need to see curriculum development as a cycle or a system. And it's kind of what we've been talking about. And so we need to continually reevaluate what and how and why, what and how and why. Focusing on the primary areas of concerns, and then we need to use data in the decision-making process. Registry, I'm not sure how many of you are familiar with registry, but when you pull up your registry results for your program, you can see how many of your students passed and how many of your students failed. but you can also get an area topic breakdown. And so you can see where students did well topic-wise and where students struggled topic-wise. And I pulled that data and was sharing it with some of our faculty the other day. And we have one area that is pretty strong. All the students are passing that section. And we have another area where it's the students are not doing as well overall in this section. And I was talking to the instructor that was teaching the area where students were not doing as well. And he looked at it and he looked at the other data where the students were doing really, really well. And his comment was, he goes, yeah, but that instructor just over teaches all that information. I'm not sure we can look at the area where students are passing and call that over teaching. And then look at the area where students are struggling and say that that's doing what they're supposed to do. So use the data that you have to focus on what's actually working, what's not working, and then get everybody involved. You got to get everybody involved. So you got to get your other faculty involved, got to get your medical director involved. And I know that's hard sometimes at the EMT level, but the paramedical, it's a must. You got to. Our COA friends are going to make sure that we get our medical directors involved in all those processes. And then we got to go back and assess the results. What happened? What happened? And then if it wasn't a good thing, we got to go back and let's do it again. Let's try it again so we can make it better. So we have this whole cycle of stuff that needs to take place. And so we talk about, what do I want students to learn? So we go back and we look at the local standards. And real quick, Annie asked a question, some thoughts about incorporating affective domain into the curriculum. And yeah, let's talk about that a little bit. The affective domain of curriculum, and great question, thank you, Anne. The affective domain of curriculum exists in every single area of curriculum. So I think we tend to look at, we talk about what cognitive, and we look at psychomotor, and then we look at the affective domain. I don't think we can separate the affective domain from the other stuff. So affective domain is obviously, we look at attitude and we kind of go, he's got a good attitude, he's got a bad attitude. But affective domain is more than that. It's kind of how we prioritize things and how we make things important. And the affective domain, the things that a student thinks are not important, or the things that a student doesn't like, the student tends not to study, and it tends not to focus on those things. Same thing with instructors. I think the affective domain has to be evaluated from instructors. The things that instructor doesn't like to teach or doesn't like to talk about is going to be reflected in the classroom because it's not being talked about. So yes, affective transcends every single component of this. Now, if you look at the ed standards, the ed standards don't necessarily tell us depth and breadth of affect, but I think what we want is, and Creswell has an affective template or affective domain of learning, and it starts with students just acknowledging what they need to do. But we need to set the expectations of, this is what I want you to do, and this is how we're gonna do it. The other stuff we can incorporate, the uniform piece, the timeliness piece, and that may not actually be written in your curriculum per se. So when you actually look at your curriculum piece, this may be in a student policy or a student procedure piece, but it's definitively there. It can't be ignored. So yes, how students interact, how we expect them to interact, and we probably need to be a little bit purposeful about kind of what and how we want, but putting a line item curriculum objective and then affective objective, and then going back and teaching that affective topic is sometimes hard. So affective is more of expectations. We need to model that affective expectation. So if we want students in class at 5 minutes to 9, because class starts at 9, we need to make sure that we're in class ready to start talking with them at 9 o'clock. We shouldn't have students in the class at 9 and then we walk in at 10 minutes after 9. That's kind of that null curriculum. That's the piece that they're getting, or that in informative curriculum that they're getting. They're getting these messages that we don't want them to get. So yes, affective domain is woven into curriculum, and it's not independent of any aspect of curriculum. And even when students get to the point of their prioritizing the curriculum piece, as I used an example, when some of our students were failing this one topic piece, and I sat down with them, I was like, "Why are you failing this topic piece?" And their comment was, "Well, we were studying more on this topic because this instructor was teaching, and we thought it was more important because this instructor was teaching and not this instructor." And that's a component of kind of that affective piece. So yes, it plays a role in absolutely everything that the students do and how they function. And so it's an underlying thematic piece. So I'm not sure if that kind of answered curriculum, but yeah, it can't be ignored. So yeah, go back and ask yourself, what do you want students to learn? And when you identify what you want students to learn, you have to make the determination of depth and breadth. So how much stuff do I want to talk about? And then once I talk about it, how much depth do I need to go into in the curriculum, or in the education standards, sorry. In the education standards, there's a piece about skin and skin disorders. And so it talks about rashes and boils and carbuncles and zits, basically. And it talks about ticks and fleas and all this kind of skin stuff. Probably on the average registry test, there's not a bunch of stuff that's going to be asked about that. Probably there's not going to be a bunch of students that are going to be called on 911 emergency calls to manage a really, really bad boil. Although it might be, people call for EMS for a long thing. So then the question is, how much time should we spend on that, and to what depth should we go into? I do think it's possible that a student's going to go take care of a patient and run into something like that, and they should know what it is, but maybe just an awareness of that topic. So what do I want them to learn? How much stuff, and how deep do I want to do it? And then the next point here, and it goes to Lisa's question or comment, is how can I best facilitate that learning? And this is the key point to us, is how do I facilitate the learning piece? And it's really, really easy just to walk into a classroom, turn on a projector, turn off the lights, turn on a PowerPoint, and just flip through the PowerPoint slides, because you can buy all that stuff. You can buy the textbook and you can buy the PowerPoint, and the PowerPoint will be right out of the textbook with the same pictures and the same images, and you can get the lecture notes that come from the textbook, which are summarized in the PowerPoint, and you can stand up there behind a podium and you can just read them stuff. And then students pretty quickly realize they don't need the textbook to read, because you're going to read it to them tomorrow when they're in class, and then they realize at the end of the semester there is no resale value for EMS textbooks. At least at our bookstore, they don't like the used bookstore thing. So that's the easy thing to do, but are you teaching them things or facilitating their learning, or are you just telling them things? And that's my thing. Are you a teacher or a teller? And just telling them things doesn't work. So how do we facilitate this? And Socratic method, or Socratic dialogue, is awesome. So it was said that Socrates was one of the smartest men around because he identified himself as knowing nothing. And so to be able to teach by asking questions and facilitate discussion and have students come to their own conclusions is great. And that can happen for sure during class. And then in the comment point, it's talked about the putting it all together in the experiential learning scenarios. And yes, this is where this actually happens. So that is a great way to do it. On the NAEMSE website, there are some videos at the bottom of the page. I think they're still listed under the paramedic portfolio process. But it's got David and Heather in it, and it talks about how to do some of this facilitated learning through scenarios and simulations, and how to debrief, and how you can involve 20 students in one scenario event and keep them all busy and all occupied. But we have to make sure that when we're running this scenario or simulation, that the scenario or simulation is being run with purpose. So what's the goal? What's the goal of the scenario? Many of you, I think, know of or knew of Twink Dalton, Alice Dalton, and she was a master of crafting scenarios and simulations with great learning points. as far as this is the goal, this is what I want for an outcome, and then have the students walk through that process. And then, yes, after they run through my well-crafted scenario or simulation, then the learning can be facilitated by the debriefing. And the debriefing, or the pulling it all together, really should come from the students. So how are the students going to assimilate what they learned? And then I can watch a little bit and realize what's been missed and what are the holes, and how can I fill those holes in. And this process needs to be this, as I say, this continuum. So our scenarios and simulations are going to get bigger and bigger and bigger and bigger and more in depth. The next thing is what sequence, and we've talked about this a little bit, but what's the order? What's the order of things I should put together in class? Textbooks commonly start out with legal, history, kind of stuff like that. In the paramedic program, I've actually taken legal and history and all this kind of stuff out of the classroom, and because there's not tons of stuff that's different or expanded from EMT. So we have web-based stuff. I incorporate legal concepts into the scenarios, but I don't spend time in the classroom actually talking about legal stuff because I assume that to be requisite or prerequisite knowledge coming in. So what's the order that I should provide this information in? And then I assess whether it worked. And then that's the stuff we talked about. How did they do on the registry test? How did they do in the field? What are the employers saying? How they do on my class exams? And then we got to come back and we have to modify and make changes. And this can even happen within the program. So if I'm teaching I don't know, an airway module, and I want the students to be able to manage a patient in respiratory distress or a patient who is apneic at the EMT level, and I choose to facilitate this learning by reading the textbook, watching some videos about placements of airways, having a little bit of facilitated discussion, case studies about what if, and then we move into a little scenario lab. And so I expect them to evaluate the patient, assess the patient, recognize that they're in distress, not breathing, apneic, open the airway, place an OPA, and start ventilating the patient. That's my goal. That's my goal of this scenario. And I identify the sequence that they should know all this stuff, and so I put it in order. And then I could just look at that lab right there and go, did it work? Did it work? Were the students able to do that process? Were they able to do what I wanted them to do? And if they didn't, what do I have to change? And so I modified, then I started all over again, what I want students to learn. Or the big process, the big picture, maybe it's a graduate. So if with the programs here at the college, once our students finish the paramedic program, they move into the associate's degree or then into the baccalaureate degree in advanced paramedicine. Are the paramedic graduates successful in that program? Are they successful in the baccalaureate degree with advanced paramedic practice? And if not, then the whole curriculum as far as the school goes, maybe something needs to be modified or altered. And so it becomes this cyclic process. And it never stops. It never stops. And some other comments down there was how they felt about the experience. I'm assuming you mean feeling about the experience, about whether it was positive or negative, or they were successful, or they were not successful, or this ongoing, or kind of this feel. Great. And so it's this huge process, right? Yeah. So it's nothing. Curriculum, like I say, it's pretty well defined as far as kind of its topic points, but it's something that we as educators have to create and we have to modify, and we can purchase templates that are going to help us. So we're going to purchase things that can help us put it together and craft it, and we have all these guidances. So we have the registry guiding us, we have COA guiding us, we have the education standards, we have the National Scope of Practice document. So we have all these tools that are going to help us, but not one of those things individually is actually curriculum. Curriculum is what we have to put together. And I would encourage us to network and to work with each other and say, hey, I'm having trouble with students doing this. Do you have any ideas? How do you help facilitate students doing this? Do you teach this before you teach this? What resources do you use? And yeah, and there's no absolute right or wrong answer. I would say that the bad answer would be that if you're putting students through your curriculum that you've identified and they're all failing certification exams, then maybe there's a glitch somewhere. But beyond that, it's kind of up to you, what you want students to know, how well you want students to be prepared. And I think we can definitively underteach students. We can recognize that, but I think we can definitively overteach students. We had a situation in the state of Colorado. EMTs are expected to be familiar with capnography, which I think is great, and I think that's more widespread. But we had an instructor that was talking with our EMT students about capnography and what it was and how important it was and all that great stuff, which is awesome. But then our students were going for their clinical rides at the EMT level, and the paramedics and EMTs were saying, okay, let's let you do the assessment. What do you want to do? And all they could focus on was capnography. They didn't care about pulse. They didn't care about blood pressure. They didn't care about anything else. They just wanted the capnography level. So what they took from the content was that capnography was important, but they took that it was the most important thing that was out there, more than pulse, blood pressure, cognition, anything else. So yeah, just have to be aware, and it's this continuum that takes place. All right. I'm about my 50 minutes. What questions or comments or anything does anybody have besides what's already been put in there?
I do want to just start us off with a question that I'm sure a lot of the people in attendance can relate to, some kind of scenario similar to this. But sometimes you'll create, a whole game plan and a large, robust plan for how you plan on implementing your curriculum. You design this whole program, and then once you start teaching it, students just are not getting it. Something is not sinking in. Somehow there's some sort of disconnect between you and them, like them accepting the material into their heads. So do you have any idea of maybe advice, general advice or examples for calling an audible in the middle, or how to somehow restructure on the fly so that you can maybe present the material in a different way or somehow reach those students?
Oh, I love that question. And I think that happens a lot. And I think one, we need to focus on the premise that teaching and learning is about the students, not about the instructor. So we need to be there for the students. We're there to help facilitate the students' learning. I think we have the obligation at multiple points through there, and there's a whole bunch of ways you can do it, but to stop and evaluate how the students are doing. Are they getting the information, and what are they not getting? And then, yeah, Nate, I think you're right. We need to stop what we're doing. But I think we need to kind of do an evaluation of what's missing. So if they're not getting it, part of what we have to identify is what are they not getting? And I think we need to go back to the students and probably through a QA/QI, an evaluation, quiz, I don't know, something, and figure out where the holes are. What's not making sense? How are they misinterpreting this information? And sometimes just listening to the students when they say this is happening or this is not happening, or they'll say something, sometimes you pick up on a piece that you're like, oh, that's it. That piece of knowledge is wrong. That because that's wrong, that's why you don't understand this versus this kind of piece. And then, yeah, I think, Nate, you're totally right. Sometimes we just have to switch what we're doing. I think COVID, I think most of you are probably familiar with COVID, pushed us into that recently, where we all had to go from what we were doing and pushed us all online and made us do something like this and rethinking what and how and why. And a lot of it, at least we found, didn't work. When we put our paramedic students on the group that was in the middle and we forced them to go online towards the last bit of class, when they came back and took their registry test, 100% of that class failed the 2 oral stations. And the 2 oral stations are the critical thinking stations. And they failed it, every single one of them. And so I realized once I put students in this format right here, and I lost a bunch of the interaction, even though I had all their pictures up and I called them and everything else, I told them that they had to be up and they had to be dressed and they had to be sitting up, they couldn't be in bed and all that kind of stuff. I lost that interaction piece. And so as I moved into the next cohort, which was going to start out online, I had to figure out a different way to figure out what was taking place. So yes, I think in the middle, I don't think we should put a curriculum in place and carry it through just because we created it. We have to see how it works. I think if we identify something's not working midstream, yes. So figure out first what's broken. What do the students not get? How are they not learning it? What's missing? Or what educationally is not working for them, and then redo it. And I think it's fine if they say, well, this instructor puts us to sleep because he just plays PowerPoint all day. Then let's do something different. So I think we have to, Nate. I think it's a great thing. See, Paul says, what active engagement, regardless of the course, there's a point of time when students get burned out. What are some of your techniques to keep them actively engaged? Yeah, I think you're right, Paul, that they can get burned out. I think we'd have to consider what our active engagement is. And I think there's some definitions of kind of the active engagement piece for sure. One, I think EMS tends to be pretty Pavlovian in our responses. So I think if I took and I've done this actually, when I've traveled around, I've done this. If I say, all right, your patient is an over-the-road trucker that presents with a sudden onset of pinpoint chest pain right here and shortness of breath, what is going on? And the entire class in unison says pulmonary embolism, which is great. I'm engaging them, but I'm not really engaging them. I like the ideas of kind of self-directed engagement, so they get to pick and choose because people engage differently. And if we look at different learner styles, which we're not talking about today, but different learner styles, some people like to listen. They just like to listen. Sometimes we interpret those people as non-participative, but they just like to listen. Other people like to just talk it out, and they just like to just talk and talk, and they talk themselves through it. And sometimes they'll just start rambling, and you just have to give them the finger and kind of go, hold on just a minute. Some people like to research while you're doing stuff. So active engagement, I like the why questions, the why questions. So not tell me what it is, tell me why it is. And so say why do you give who gets aspirin? Oh, and this is a great example. Who gets aspirin? And people say, well, we give it for cardiac chest pain. Okay, great. But then maybe we ask the question, why? And I was actually guest instructing at a school, not even in this country, actually. And as I was participating in this class, I said, who's getting aspirin? And they said, well, cardiac chest pain. I said, great. And I said, well, okay, great. Why do we give the aspirin? And this person from the back said, because it takes care of the headache given by nitro. And I kind of chuckled. And then I watched the group and I realized that was the common theme. They felt that they believed that aspirin was administered to chest pain patients because it relieved the headache associated with the nitro. And so the why questions can get them reflecting internally and thinking about what they know and what they don't know. Because what students don't want to do is students just don't want to regurgitate what they know over and over and over. But commonly students will like to delve a little bit deeper and get them involved. And I think we kind of have to let students do what they want to do. So if a student just wants to sit for a little bit and just contemplate, I think we should check in with them and just kind of walk around and go, you doing okay? What questions do you have? And make sure they're okay. I think the students is talking. He's going to burn everybody else out. So we have to tell him to just hold on just a minute, hold your thoughts. But yeah, I think they get burned out. And so we just have to make it interesting learning experiences for them. And so interesting tends to be things that are exciting or something different, or having them wonder, question why or how or when, and not just regurgitate. So yeah, I think the burnout comes from just regurgitation. Even when we do, mega codes or scenarios, I mean, how many times can you run a VTAC cardiac arrest, right? At the paramedic level. And so I think, yeah, they walk in and they just get burned out and they turn off. So I think we need to watch that. And at which point we see students just burning out and not participating. We know that learning is attached to emotion. And so pleasure and pain. So we need to create some type of pleasure, or we need to create some type of pain to facilitate this learning process. And so if we're not creating either, if we're not creating a pleasurable experience or a painful experience, and we should mix those up. I don't think you should pick one and say mine's a pleasure classroom or mine's a painful classroom. I think you should mix them up just a little bit. But if we're just creating a null classroom where students are just attending and they're listening and they're falling asleep and they're texting what they're going to do tonight when they get out of class, learning is not going to take place. And we need to watch that and modify what we're doing. See, Cindy says, I've experienced an EMS institution curriculum where the bar was held high, producing outstanding EMS personnel. Over time, the student population has become less engaged overall, almost wanting to be spoon-fed. True story. I don't. It's a great question, Cindy. I would agree the student population has changed. And a lot has changed in education kind of across the country in fundamental foundational education pieces. We move people through education not based on where they are academically, but by how old they are. So if you're 16, you're going to be in the 11th grade. That's just the way it is. 16, you're going to 11th grade until you turn 17th, and then you're going to the 12th grade. And so we move people kind of through in that process. Part of the stuff with primary education is, and this is not an attack on primary education, but I do think there's a tendency that helps students become successful to just make them successful and get them gone and get them out. And so when they come into the classroom, to our classroom, we might have different standards for them. I think EMS too, I think the population of people that EMS deals with, at least from my experience, is a little bit different. They've said that Barack Wolf wrote a book quite some time ago, years ago, about ADD and ADHD in the EMS provider. And it's been estimated that ADD and ADHD hovers somewhere between 60 and 75% in the average EMS provider. That student commonly struggled in primary education. And so that student who struggled in primary education, they may have a lot of hand-holding, guidance, nurturing, meet the minimum bar kind of stuff to get them through. And so our classrooms are different. And I think overall the younger society, I mean, think about when you talk about spoon-fed, think about that as our society now. They can get on their phone and with a click of a button, they don't have to click a button. All they have to do is just talk and ask the phone a question, and the phone gives them an instant answer. They don't need to look it up. They don't need to research it. They can just ask the question and get it right there. So yeah, there's a component where they just want to just be fed whatever is taking place. So it might be a burnout. I think it's different though. I think it's different than a burnout. I think it's kind of how they grew up, and we need to create an experience in our classroom and set that expectation. This goes back to the affective thing. This is the expectation that I have for you in my classroom, and this is what I want you to do when we're in the classroom, and this is how I expect you to participate. And there's an old saying that says, students do not care what you expect, only what you inspect. So part of your syllabi, which can be a component of your curriculum, is if you want them to participate in discussion, that needs to be a graded event. But make the discussion worthy of their participation. Don't make it an in unison chant for the signs and symptoms of thoracic aortic dissection, because that won't help. And I hope that answered or comments. Unless it's absolutely so many students feel they will pass the course even if they are failing the course, they're expected just to be pushed through as if they were in high school. Expectations must be set the first night of class and followed through it. Yes, I think yes, we need to set the expectation. Hugely important. But number two, you are absolutely right. You've got to follow through with the expectation. You've got to follow through. And it's hard. It's hard, but if our tests are appropriate, our tests should be identifying the weaknesses in the class. And our tests should actually be cutting students. There should be points where they're actually cutting the students out. And then we need to go back and help the students fill in those holes and then reevaluate them and move forward. And at which point the students can, because there are tests and there are students, we taught the information, we covered it in class, we want them to be successful. And so we tend to take it personally sometimes if a student can't pass the course. We can't. We can't. They have to hold up. Over the years, the students that I've dismissed largely from the paramedic program, and they've been in my classes with a variety of emotions, from crying to frustration to confusion to anger, all kinds of frustrations when I've dismissed them from the program. The majority of them have come back. And I say, you just need, the nice thing about being 15 separate classes, if you fail cardiology, you just got to come back and take cardiology, you don't have to take the whole program again. So they'll come back and just take that one course again. And almost across the board, 100% of them has said, thank you. I didn't like the fact that I needed to do it again, but the fact that I had to do it again, I feel like I'm a better provider. So yeah, once you set the standard, hold that standard. You don't let those puppy dog eyes of your students kind of change your mind.